Hi, I'm Dr. Ken Fujioka, Director of Nutrition and Metabolic Research at Scripps Clinic in San Diego. And this is Dr. Manson. If you could introduce yourself.
Of course. Spero Manson. I'm a distinguished professor of public health and psychiatry at the University of Colorado Anschutz Medical Campus, where I direct the Centers for American Indian and Alaska Native Health.
So we just heard a great lecture on, really to me, community health, and you've done it at an incredibly large scale and been incredibly successful, which is, I think, one of the hardest things to do. Could you give us some, insight on how do you do it on that big of a scale?
Well, that's a wonderful question because, as you know, Ken, most of our efforts are really focused for the most part at the level of the individual. And how do you scale that up so that you can make a difference truly at the population level? And that's the question that we've been struggling with in our work for the last 30 years, and the Special Diabetes Program for Indians gave us the opportunity to innovate in that regard. As I noted at the close of my remarks, there were a number of keys to success. And I really want to set the record straight that the success of the Special Diabetes Program for Indians is really the success of the providers and the people in the community and the champions who participated in it. You cannot instill the level of commitment, the motivation, the desire to change, and to bring about appropriate leadership in mobilizing your peers in the community than through these kinds of community-based initiatives. And so the question is, knowing that that's there, how do you tap into that? And that's one of the things that we really focused on, was how to take advantage of those sources of strength and resilience and commitment that are there, but get them mobilized and focused in a particular way.
This use of champions is interesting and somewhat new to me, being your standard investigator. How do you find a champion? How do you go about getting somebody out of the community who's going to help you out?
Well, that's a wonderful question. There are champions for many different initiatives across all of our communities, native or not. The challenge, as you point out, is figuring out who they might be. And I think part of that discovery process is sublimating your own personality and going out and shifting from being a professor to being a student in those communities and being open to the lessons that people are quite willing to share with you if one allows them to take the lead. And so you can quickly discover as you go and attend community gatherings, or you go to a clinic area where you may perhaps shadow a provider and listen carefully, particularly the community-based providers in these settings. And I think you can quickly discover who many of the champions are. And then, having done so, engage them in their own terms, soliciting their participation in ways that will be win-win for everybody. And there's no doubt, it takes a really different way of thinking about these things, reframing what it is that we do as clinicians or investigators. And it does take additional time. And many of the challenges of our peers is the impatience with which we suffer in trying to advance these agendas, and you can only move as quickly as your community wishes you to.
You did something that, to me, someone who deals with, how do you regulate weight, which I thought was rather unique, and it's kind of like this farm-to-table approach. Can you tell me a little bit more about how you got the community involved with actually growing fruits and vegetables and then preparing them and then actually getting them into the home?
Well, Ken, it goes back to this notion of the champions and the key stakeholders. I'd love to say that it was my idea originally, but it wasn't. It was the idea of a couple of these key stakeholders who had already been into sort of the local community garden initiatives and saw the opportunity to apply that to the Special Diabetes Program for Indians. And what my role became was crediting that, saying that this is really interesting, and then giving those champions a platform within our ongoing strategic planning and implementation process to make what they'd been doing known to the other grantees, and it just caught on fire.
Interesting.
It was fascinating to see. And then, part of the challenge is figuring out, well, first off, is discovering that peer-to-peer learning is one of the most powerful mechanisms. It's not sort of the didactic, I'm the expert. There's a saying is we need more expert Indians and less Indian experts in our communities. And so the challenge is to credit those who have this experience, this expertise, figure out how to provide them with a supportive platform to promote those kinds of approaches. But it's hard. We're not trained that way initially, right?
No, not at all.
Yeah.
The other one, and again, we struggle with this, particularly at the individual level, is how did you get the group as a whole to what I say move? In other words, you have very good numbers on increase in activity level, which is, again, one of the harder things to do in a larger community.
It is. So one of the things we thought about is we assumed that we would have more resistance to starting something new, okay? So what was already going on that promoted the kinds of activities and engagement we thought would be in service of, for example, increased physical activity and improving and enhancing peer support. So we looked within the communities to those kinds of already engaged activities and figured out how we could insert this agenda into those ongoing activities. And again, it's your champions, your key stakeholders who help you figure that out. And they did wonderfully. That's exactly why. The adoption, the uptake of those kinds of physical activities within the already existing, naturally occurring events and circumstances in the community was so successful.
What were some of the activities that you found that were already in place that you could just promote?
Yeah. Well, during my remarks, I pointed out that canoeing, for example,
Oh, wow.
is really big in the Pacific Northwest and also in the northern Midwest. Dancing, particularly in the traditional fashion, both for men and women. And so with the key stakeholders and the champions, we focused on developing and joining groups that focused on young people and brought in the participants in the program into that particular learning process. And so we were doing several things at the same time. Again, it was the champions and key stakeholders' ideas, but we were engaging the adults with youth who were already interested in doing this. We were thinking ahead about obesity among our children in Native communities,
Sure.
which is epidemic as well as it is generally for our country, but particularly among Native people. So it was figuring out how to build these bridges between adults and other family members as well as their counterparts in the broader community. And again, our champions were so creative and innovative. They never lacked for suggestions about how to do that.
You know, getting to talk with Dr. Manson was just truly a neat experience, only because it helped me figure out when I'm doing studies, but also when I'm treating patients, you need to find your champion. In other words, who's that individual who's going to help you out? It might be somebody in the family, who knows? But finding a champion is just, to me, a great thing, and this was truly a great experience.
Well, I couldn't agree more with you about finding the champion, but one of the things about champions is that they not only exist, but they're also made. So figuring out how everybody can be their own champion is really, I think, the ultimate goal.
Well, with that, I hope you enjoyed it.
Thank you.